Hello, everyone, and welcome to Kroll's webinar on resumption of business operations. The format of today's webinar will be a 20 to 25-minute presentation with a Q&A at the end. Questions can be sent to staff in the chat section on your toolbar. If needed, the speakers will stay on the line after the allotted time to answer questions. If we're unable to get to your question, please feel free to reach out to Chris and/or Jeff, or email the team at securityriskmanagement@kroll.com. The handout section of the toolbar has downloadable slides. The presenters today will be Jeff Kernohan and Christopher Berry from Kroll, a division of Duff & Phelps. Chris Berry is a senior manager in Kroll's Security Risk Management practice. Chris has provided a wide range of security, emergency preparedness, crisis management, and business continuity services to clients across many sectors, including finance, manufacturing, hospitality and entertainment, technology, and education. Prior to joining Kroll in 2015, Chris was the VP of Global Security and Safety for a large multinational corporation with presence in 22 countries across the globe. Jeff Kernohan is an Associate Managing Director in the Security Risk Management practice of Kroll, a division of Duff & Phelps, based in Chicago. Jeff has over 20 years of experience delivering comprehensive security services and protecting people and property.
Hi, good afternoon and welcome for joining. Good morning to the folks out on the West Coast. The objective of today's presentation is to provide you with some general information and guidelines that you and your organization can reference to keep people safe and assets protected when resuming business operations in the wake of the COVID-19 pandemic. The situation is extremely fluid. New considerations are cropping up seemingly on a weekly basis. Therefore, we're going to attempt to provide you with some current and timely specifics in addition to the best practice general guidelines. The first thing that you should be cognizant of is that the management of the reopening process really needs to be coordinated with local site management as well. Initially, don't do this alone. Get partners. It's strongly recommended that a multidisciplinary team be put together to ensure that all the many aspects of returning to business are considered. The team should consist of senior level representatives of infrastructure groups such as business operations, human resources, security, facilities, and legal. A key component of your process is, if your organization has multiple sites, is to ensure that it's managed at a corporate level and that individual sites are not making decisions upon their own. It's important to have a consistent approach to this. Despite the fact that there's going to be differences from site to site, again, a consistent overall approach and process should be taken. It's recommended, however, that you do involve local site management in the processes because they're going to be best suited to tell you in a real-time way what events are occurring on the ground and at the particular location, and what local site specifics might be applicable to the overall decision-making process. Inconsistencies from site to site or in your decision-making process potentially are going to result in human resources problems and potentially expose the organization to liability concerns as well. As I said, not all locations are going to be the same. It's going to differ from across your organization. In terms of developing plans, communication is going to be vital. Communication that's proactive, that's transparent, that includes all your stakeholders, employees, property managers, business partners, customers, shareholders. Communicate with everyone as to what your plans are in advance, proactively, and again, be completely transparent in the communication and be prepared to update the communications on a regular basis as situations change and circumstances merit. Be flexible. Again, with the fluidity of the situation and events changing dramatically, the best laid plans are probably going to be ones that are going to be changing frequently as situations merit. Have that mindset from the onset. It's going to be easier to be flexible if you have the mindset of being flexible from the beginning. I often use the term, the example of An individual running in a track meet and getting down in the starting blocks, and the gun goes off, and they think they're a 100-yard dash runner, and they hit the first hurdle, and they hurdle, and they go over the hurdle, and they hit another hurdle. You really need to have the mindset that you're a hurdler from the get-go, because there are going to be circumstances that require you to be flexible and to pivot quickly. The plans that you do develop also need to be monitored to ensure that the processes and protocols that you implement are being adhered to. And again, when you're getting reports back as to what's occurring, that you can make changes as necessary. If you just implement protocols and processes, invariably sites left on their own are going to veer off course. So if for no other reason than to do those course corrections as needed and to keep the consistent approach across your organization, it's important to have those monitoring processes and protocols in place. Have a reversal plan ready to go. It's I think logical to assume that events are going to change back, that are going to require offices and facilities to potentially shut down again. The good thing about this is that you've probably implemented plans over the last several months and practices that you already have in place that you can quickly revert back to. But again, I would keep those plans dusted off, not let them get stale, have them ready to go if needed on short notice. And one of the crucial things as well is to coordinate with, if you're in a multi-tenant building, it's vitally important and critically important that you coordinate with local property management. You need to ensure that the basic building services, HVAC, maintenance, facilities, security, et cetera, are going to be up and running in a fashion that's going to be suitable to your organization. You also need to know what the building is preparing to do so that you can tailor your plans around what the building is doing. There may be some things that you want to do that the building is going to do for you that you don't have to implement. So from a cost saving standpoint, from an efficiency standpoint, try to get as much out of the base building as you possibly can. And again, know in advance what they can and cannot do. How are they going to handle visitors? How are deliveries and pickups going to be handled? What impact is there going to be on housekeeping services? There's a long list of things that you really need to have frank conversations with building and property management to understand prior to you making your own plans. And with that, I'll turn it over to Jeff.
Hello. I think a lot of what I'm going to cover is really some of the stumbling blocks that our clients have come upon when they're trying to implement their return to work. One of the first ones, and one I've seen on multiple occasions in video conferences that we've been having with clients, is we ask who is going to be managing health screening at this building. And invariably, they all point across the virtual conference table at each other. The building manager points at the security company, and the security company thinks that the tenant is going to be doing this. And this is where we get into a bit of our issue. Everybody assumes that somebody else is going to be doing it. And we have seen repeatedly where base building doesn't believe they need to do it. Security doesn't believe they need to do it because of their insurance policies, things along those lines. So we have seen that bite several people when they tried to. They made assumptions that they could walk right back and make this happen. They found out that they needed to fully staff and needed to do it themselves when they came to do those kind of things. When it comes to that screening, if you're going to do the screening, how are you going to provide protection to those personnel? It's been fairly easy in some of the fulfillment centers and distribution centers to set up the screening points and to set up plexiglass that you can, use your handheld thermometers or even some of the thermal imaging cameras with, and it's been fairly simple. But when you go to a high-rise building and you're working in a lobby with several entrances and large open population and a lot of retail establishments, it becomes very difficult to determine how you're going to deploy that, how you're going to protect your personnel as they do the screening, and how you're going to manage. Do you screen everybody that comes into the local Starbucks? Are you going to screen only people that are coming into the facility for long-term, for that prolonged exposure? These are questions that you're going to have to answer. They will greatly impact how you're going to deploy this type of program. Really, what we need to understand is what you're going to gather. Most states are going to have some requirement that if you are taking temperatures, you need to have notification posted throughout the facility saying that you are gathering this information. and you need to determine what you're going to store. Most of our clients are not keeping any records, but there are some that determine that they wanted to keep records so that if base building says you have to go home, they need to have something to show that this person tested at this level. And that's why we sent the CEO of our largest tenant home instead of letting them into the building. So when you do have that, you do need to make sure that you're meeting all the privacy requirements and that you're actually keeping track of what is really pertinent and not keeping any of those extra details that just make it more difficult to make sure you're protecting the privacy of people coming into the facility. When we come into the actual format of what you're going to be using, right now the thermal imaging is big. Everybody's looking at that. They're testing those systems. We're using them with several clients, and they're working fairly well. There's some things that we'll go over here that you know, that are impacting their effectiveness. But for the most part, you need to determine what you're going to use, what your format is, and you need to get that equipment, you know, as soon as possible, because it is getting very difficult to get some of this equipment, and you need to be able to put it in place and test it and get your people trained on it before you go to deploy this. We don't want it all done day one and you're trying to figure out how to use the thermal imaging and you see some of the issues that we've come across. You need to basically have this all figured out well before you got to open up your building, your office, wherever you're going to be working. You know, a big part of this is really going to be after we do the first level of health screening, you know, what's next? Do we have secondary and tertiary screening levels? Do we say, okay, you've measured at 100.4, so you're out the door and you're going home? Do we take them into a secluded area and we do a heightened temperature check? Do we do questionnaires with those people that might be testing high? These are things that everybody's trying to tackle at this point. And it's one that you need to have formalized and you need to have documented before you go into this process. There's a lot of what we've seen, a lot of people that are coming about and they're making the decision on the fly. They have a temperature. We've seen people that come in and they present temperatures in Southern California of 94.5 degrees, and that's technically hypothermia. We have a lot of issues with that. How would that be? And the clients are trying to figure out, well, what do we do? Do we send that person home? This all needs to be formulated before you start making the process. We don't want your field people making decisions based on, you know, how they're going to handle people. We want this to be a corporate-wide policy, and we want to make sure you cover those outliers that could certainly affect you. And then really when it comes down to how do you envision it to take place, that's the question that a lot of our clients are having the most issue with. You know, CDC wants you to do it outside of the property. Most of our clients are not really set up to allow for proper protected screening to take place outside of their facilities. We have seen some that have successfully done that, but we've seen most are looking to do that inside of their property, maybe outside of the security perimeter of their facility, but you know, somewhere inside the facility, just because it's so difficult. If they have queuing, if they have a lot of throughput that they need to get through, you can't really keep people out in the 108-degree heat or in the pouring rain while you're going through and screening people. And that's one that, you know, you're going to need staffing to manage that. You're going to need signage. You're really going to need something to tell people where they need to stand, where they need to go, how they're going to manage this, so we maintain that social distancing as needed as we go through our processing. The logistics and, you know, what we're really seeing, and I'll tell you, you know, from our experience, most of the ones that we've done up to this point have been essential businesses that had to continue operating, and the issues they've seen are largely focused on the thermal imaging cameras. They work really well, they're very efficient, but they do have a lot of false positives based on what the person might be wearing. If they have sunglasses on their head that are metallic, they contain or retain more of the heat, and they're setting off alarms, and we're going into secondary and tertiary screenings because of those. So you need to understand some of the limitations with the equipment. Another limitation with a lot of the thermal imaging that we're seeing is you really need to vet the manufacturers. There's just so many startup companies right now. And what we have found, we've been asked by clients to vet manufacturers that say they work for all of these big Fortune 100 companies. When we speak to our contacts at those Fortune 100 companies that would be implementing these programs, they've never heard of them. So you need to be very careful in your vetting to make sure you're getting, you know, a known entity when you're doing this, and you're getting someone that, you know, has been in the business and is not just a startup trying to figure this out. It really can't have those kind of failures day one when you're trying to go back to the office if you have a company that really hasn't quite figured out how to do this. When we go into some of the things that we really need to do in the office, and this is where we've seen, in both our essential businesses and in some of the new, non-essential businesses that have gone back to work in some states, everybody's trying to figure out how they're going to maintain social distancing in the workplace. Most have found that, they have to go to some level of lesser population in the facility just to be able to maintain that. Most people don't have offices that allow you to expand and move people around and still have everybody there. We try to keep our offices, as efficient as possible, so you're not going to have that capability. We've seen everything from split shifts to split shifts across a week-to-week basis to a month-to-month basis, where you might have your department split into 2 or 3 parts, and they come into the office once for a week, and then they work from home for a week, and we've seen a lot of that working effectively. What we've seen is a lot of people have gone to almost a month long, where you're on for 1 month in the office and then you're off for a month, because it's much easier for them to maintain the population of the facility across whatever may be vacation, sick time, whatever may come up. They found that it's just simpler and less of a lift if they do it on a month-to-month basis. But we've seen also very successful deployments on week-to-week. It's really the only way that you can maintain the proper social distancing when it comes down to getting your employee population back. And I'm sure everybody on the call has noticed that things are still moving well in the work from home population, and that's a consideration that a lot of offices are making. We make this a lot easier on ourselves if we're able to keep some of those people home that we don't necessarily have to have in the office. When we look at some of the common areas, and this is one that we have a lot of debate with clients, because they need to be able to open up common areas, but there's some of those that are very touch sensitive. We found some clients that they have ice machines that they didn't realize they did not have scoops in the ice machine, and people are going in and using their hands to grab ice out of these ice machines. I mean, these are the kind of things that people have not thought about in a lot of situations. You'd hope they would, but now it's a much bigger issue in today's break room, lunch room, snack area considerations, where we need to be able to determine, can we safely open this snack room? Can we safely deploy snacks for our employees? Can we safely deploy a refrigerator for our employees to bring their lunches? If we don't, is there enough retail food establishment in our neighborhood that we could still have our employees be able to go out and get food? We found some people going back to work, and the restaurants around them have not come back at a level high enough to support their staffing yet, so they're having to scramble with everything from food trucks to catering where possible. One of the things that when we go back to work, most people are having the most issues with is getting the PPE and enforcing the wearing of the PPE. Whatever that's going to be for your organization, being able to provide that or require that your employees provide their own is one that a lot of people are having to tackle. I would say the majority that we're dealing with are coming up with a way to provide some level of face covering for their employees. The ones that are not are essentially requiring the ones that do decide to come into the workspace to provide their own. But I would say that's a great minority when it really comes down to how all of this is working, and how we're going to go about deploying people in the offices. Some of the things that we've also seen are really, if they do have the programs that they're going to deploy, where they're really falling flat is deploying the training and the signage and the documentation of how this is all going to work for their employees. We've seen a lot of clients that they'll make a decision, they'll put it in writing, they'll go and they'll do it, and they'll find that there's an issue, and they'll just change midstream, and they won't change any of their signage. So there's basically signage and training material and things out there that don't really comply with what's actually happening. So that has been one that we've seen more often than not, because, as Chris said, this is a very fluid environment, and we need to make sure we're keeping up with what we're doing, but we also need to make sure that all of the supplies and the accessories that go along with our program are also keeping up with those changes to our program in this fluid environment that we're dealing with. I think, really what we've seen, and what we definitely are here to be able to provide answers to your questions at the end of this, but what we're seeing is people are having to figure these things out, and most of them are very reluctant to make the decisions until they start seeing other people doing it successfully. And as you've seen, a lot of the companies, the big tech companies, just keep pushing it off farther and farther when they're going to bring people in. So there's going to be somebody that's going to have to make that decision that we're going back and this is how we're going to do it. And that's going to be, for a lot of people, their test case and what they're going to see, where they're going to fail, how they're going to do it. It's been the same way in the essential businesses. We see it across our essential business clients that they're all keeping track of what the others are doing to see where the successes are and where the failures are, so that they don't have to follow those same routes. I think, at this point, we could probably move. I hope we have several questions that we wanted to cover. So we wanted to leave a little bit of time to be able to allow everybody to jump in and present their questions. I think we can probably hand this back over to the moderator here and see what we can do about answering some of your questions that have come up during this webinar.
Hello, everyone. If you do have questions, please enter them into the questions section on your toolbar. Chris and Jeff, we did have a question come in. The question is, are you seeing clients focus on limiting movement of staff throughout their spaces to allow for more efficient trace control procedures, for example, floor to floor or building to building?
Yeah, that's been a big push, because I assume most of the essential businesses that might be involved with this call have already gone through a lot of trace control, because you've had it in your facilities and you've had to do these trace control reviews to determine, exactly what has happened and who these people came in contact with, people that were, affected by COVID-19. A lot of the people that have not gone back to the office might not have experienced that yet. In the office environment, something that we're typically advising and looking at is limiting that exposure to the greatest degree possible. So if we have, a department that sits on the 4th floor and doesn't necessarily need to visit 6th, 7th, and 8th floor, it's much easier when we go back to do the trace control to know that this person was on an elevator to potentially expose people, in a lobby, and on the 4th floor than it is to go through your entire environment. It also happens in the buildings. A lot of the buildings that are coming back, the big campuses that are coming back, are limiting you to your building, and they're limiting the screening areas to specific buildings, so they can say, if we do have a case that presents, when we go back and we do our reviews, we can certainly look and see where that person was, and we greatly limit and greatly impact the effectiveness of our overall trace control investigation.
And if I can add to that as well, I think getting back to the communication aspect of whatever processes and protocols you do implement, you don't want your staff showing up for work on the first day and finding out what it is that they're going to have to go through. I think it's very, very important to communicate that in advance, so that there is an awareness and that there is an expectation as to what measures are going to be in place.
Yeah, it's funny, a lot of these that we've already implemented for essential and non-essential businesses going back to the office space are based on essentially their current environment, where they're going to be operating. But most of them that are really having issues and falling down kind of day one are the ones that had to rush into this, and they decided, last minute, that they needed to figure out how they're going to do this. A lot of people, when they have their first case, they're going to start deploying the health checks, and they have a case, it surprises them, and then they instantly have to start deploying the health checks, and they're finding they can't find the staffing to do it. They can't have their own people to do it. They don't have the equipment to do it, but they have a policy written down that says, we're going to do this as soon as we have our first case. And that's one that we find that the ones that actually did the planning before, did the testing before, did the training before, and got everybody on board before they actually deployed this, they're operating a much smoother function, and they're actually having a much greater success rate when it really comes down to, how they're deploying and how they're responding to the changing environment.
Great. Next question, I'm actually going to combine two. So the first one, I'm attempting to determine needed PPE for the office. What are some protective items that companies may not have considered but would be worthwhile in investing? And the second question is, any suggestions on where to purchase PPE?
Yeah, the question on where to purchase them is one that we hear daily, pretty much. It's very difficult, especially if you're looking for PPE in the mask and the hand sanitizer and things along those lines. With the hand sanitizer, what we've really seen with a lot of our facilities that continue operating throughout this process is that some of them really are looking at how they go about working with local vendors, and you've seen a lot of the distilleries and a lot of the craft brew places that have started making their own. So they're partnering with local partners to get it, and that's the way that we've seen some good success. It's starting to come back, and the market's coming back, and people are starting to get some of the things they need. But it's still fairly difficult, for a lot of this to get some of the very important pieces that you might be looking for. As far as the equipment, I mean, Chris, you can go over a little bit of the equipment here. I'm looking for some resources here.
Yeah, I mean, certainly masks, I think, are going to be at the forefront. And again, I think that the determinations that are going to need to be made are you going to permit employees to bring their own mask and have a face covering? Are you going to supply them? Are they going to be consistently supplied? In terms of a best practice, again, this is an extremely fluid environment and different people are doing different things. I don't think that anything has been proven as yet to be a foolproof best practice that we could recommend. But again, I think having a plan and a process, but at the same point in time, being flexible to change it on an as-needed basis. I would also be prepared, again, going back to that multi-tenant environment, where your employees are going to come back and they're going to see that different things are occurring in different tenant spaces. They're going to speak to people in elevators. They're going to just be aware of what is going on in other sites and in close proximity. And they're going to be asking a lot of questions as to why you're doing certain things or why you're not doing other certain things. And I think that you just need to be very prepared for that level of communication.
And some of the things that we have seen prove to be beneficial, one of them is the ability to get plexiglass and be able to build your own equipment. In the markets where there's a lot of essential businesses, it has become a little bit more difficult to get that. When people are doing their health screening, it's harder to find the actual equipment that they're going to need to build out their barriers. So that's one that it might come up depending upon who you are and what you're doing with your equipment. The temperature check, most people are going to the thermal imaging. The ones that are going to the non-contact, you can find them. Most everybody's looking for a certain model that everybody's using, and that one's become pretty hard to find, but you can find other ones that work that are within the same range of effectiveness. So we have been able to find those for clients. And then there's a lot of vendors out there that you can essentially bring in to provide all of this. They bring the equipment, they bring the personnel, they bring the expertise, and they do this all for you. So we've seen a lot of people going, kind of leaning in that direction, because one, it helps them with being able to deploy the program quickly. Two, it helps them when it really comes down to, who's going to be responsible if they do have, issues, who's going to be the one that has the expertise to say that this temperature is valid and this temperature was not valid, whatever it might be. They like to get a little bit of separation there and let the outside experts provide that. We have found that those people are getting booked up pretty quickly, but that's one that we definitely have seen a bit of a trend, is not just PPE equipment, but PPE people to come in and do some of your screening for you.
Great, thank you. And we have reached our allotted time, so we want to thank everyone for joining.